Hello everyone. Today, we're exploring the medication levetiracetam, widely known by its brand name, Keppra. As always, this session is designed for educational purposes. For any health-related questions or concerns, please consult with a healthcare professional. Description: Levetiracetam, or Keppra, is an oral and intravenous medication categorized as an anticonvulsant. It is primarily used to treat seizures in people with epilepsy. Levetiracetam works by affecting the transmission of nerve signals in the brain, helping to prevent seizures. It is often prescribed in conjunction with other medications to manage various types of seizures in adults and children. Levetiracetam can be used by itself in patients from 1 month of age with certain types of seizures such as myoclonic seizures in people with juvenile myoclonic epilepsy and primary generalized tonic-clonic seizures. Warnings: Levetiracetam should be used cautiously in individuals with kidney problems as its clearance is reduced in these patients, which may require dose adjustments. It is also important to monitor for potential psychological effects such as mood changes, depression, and even possible suicidal thoughts. Patients with a history of psychiatric disorders should discuss these risks with their healthcare provider before starting treatment. Before taking this medicine. Before starting levetiracetam, it is critical to discuss your complete medical history with your healthcare provider. This includes any past incidents of mood disorders, kidney disease, or allergic reactions to similar medications. If you are pregnant, planning to become pregnant, or breastfeeding, you should weigh the potential benefits and risks of using this medication with your doctor. Levetiracetam requires careful monitoring, especially during the initial phases of treatment, to manage any potential side effects effectively. It is important to inform your doctor if you are taking any other medications, as levetiracetam can interact with other drugs, potentially altering its effectiveness or increasing side effects. Side effects: Common side effects of levetiracetam include drowsiness, fatigue, and irritability. Some people may also experience more severe effects such as coordination difficulties, changes in mood, or unusual changes in behavior. Rare but serious side effects include potential signs of infection, such as sore throat, fever, significant mood changes, and symptoms of an allergic reaction like swelling, rash, or difficulty breathing. Interactions: Levetiracetam may interact with other anticonvulsants or medications, altering blood levels and efficacy. Always inform your healthcare provider about all the medications you are currently taking, including over-the-counter drugs and herbal supplements, to avoid potential interactions. Dosage: The dosage of levetiracetam must be carefully adjusted according to the patient's age, weight, type of seizure, and kidney function. It is typically started at a lower dose and gradually increased under medical supervision. For most adults, the starting dose is typically 500 mg twice daily, which can be adjusted based on the response and tolerability. Avoid: Patients taking levetiracetam should avoid activities that require mental alertness, such as driving or operating machinery, until they are sure how the medication affects them. Alcohol consumption should also be limited as it can increase the sedative effects of the medication. FAQ: A common question about levetiracetam is regarding its safety in young children. Levetiracetam is approved for use in infants 1 month of age and older for specific seizure types but should be used under strict medical supervision. Closing: That concludes our overview of levetiracetam. Remember, this information is intended to provide educational insight and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns regarding treatment options. Thank you for tuning in.